I'm Dr. Jennifer Robinson, Assistant Professor at the University of Mississippi Medical Center. It is indeed my pleasure to have with us today Dr. Savina Schoenhofer, a nursing theorist and nursing scholar. Dr. Schoenhofer is a professor at Alcorn State University and also a professor at the University of Mississippi Medical Center. She is also a charter member of the International Association for Human Caring. And we are pleased to have her here to talk about her theory that was developed by Dr. Ann Boykin and Dr. Savina Schoenhofer about the theory of human caring. Dr. Schoenhofer, thank you so much for being with us.
Thank you, Dr. Robinson. And occasionally I'll probably slip and call you Jennifer, and you please slip and call me Savina.
Okay,
since we are friends as well as colleagues.
I can do that.
I'm very glad to be here, and I appreciate the interest in the theory of nursing as caring.
Why don't we start with you tell us a little bit about yourself. Kind of set the stage for how you came about seeing the need for a nursing theory, the gaps, and just kind of your background that led you to this.
All right. When I entered into nursing practice at this community mental health center, and we basically worked as a team, and to a large extent we all engaged in the same activities. And I was always trying to figure out, what is it that nursing brings? When I studied psychology, I was taught the focus of the discipline of psychology. And it was pretty easy to, when I would ask people in social work, they could articulate pretty easily what the focus of their discipline was. And we all could easily identify what we shared. But I did not have the language to clearly express in a defensible way what it was that nursing is, what nursing brought to the situation. So I was always looking to understand this, looking for a way to articulate this. And after I entered into, became faculty of nursing at Wichita State, we brought in a consultant, Dr. Marilyn Parker, who helped us develop a curriculum based on Orum's self-care deficit nursing theory. And it was from Dr. Parker that I began to learn that where you find the language to articulate the specific focus of nursing is in these nursing theories. And she had us study a whole range of them, and then the faculty picked the one that we thought would work for us best. Let's see now. Okay, I guess the next step in this process was when I joined the faculty at Florida Atlantic University. It was a very new nursing program at a very new university. There were only 6 faculty. I think when I came we added 3, which made a total of 9 in nursing. I was one of 3 with doctoral preparation, and we were just beginning to do the work to become NLN accredited. The curriculum they had there was based in caring, but the language of their curriculum documents didn't express any unique focus for the discipline of nursing. So we worked very hard to keep caring at the center and use theory-based knowledge of caring to devise a curriculum. And we succeeded. In fact, it became a model curriculum. But when the curriculum work was done, Ann Boykin and I decided that, well, we still hadn't articulated nursing to the fullness of our desire. And so we kept on working. And it was that work that wound up being the theory of nursing as caring. I believe we first presented the theory at a theories conference in Miami in 1991. And then the book, this is the second edition of the book. This was originally published in 1993.
What, as you were thinking about, as you were doing this curriculum work, and as you were, you and Dr. Boykin were, got together and decided that there needed to be more work, what was the gap that you, that really kind of drove you, that just kind of bothered you so much that you just had to do this work?
Yeah. Well, the gap was that the statement of focus in our curriculum had caring being a means to an end. And by that time, Anne and I were both heavily involved in the International Association for Human Caring, and we both studied everything that was written in nursing on caring and all the antecedent work from education and philosophy and other disciplines. So by that time, we had come to believe, excuse me, come to believe that nursing was not a means, it was an end in it, caring was not a means, it was an end in itself. And nursing actually was the means to that end, or let's say was one means to that end. And so that was the idea that we took and further developed, and which wound up being the theory as it's explained today.
Mm-hmm. Okay, why don't you tell us a little bit about the purpose of the theory? You've touched on that a little bit in your introduction, but tell us what the purpose of the theory is.
We developed nursing as caring specifically to be what's called a grand nursing theory, or a general nursing theory, or what a nursing philosopher, Kikuchi, calls nursing philosophical framework. We intended to create a theory that would be capable of providing an explanation for any and all instances of nursing. That's what we set out to do. And there's some evidence that that's what was achieved. Now, ask me your question again, because I think I lost part of the track.
The purpose of
Purpose, okay. So, the purpose of a grand theory is to provide a theoretical, an integrated, let's say, an integrated system of value, thought, language, and action to guide the development and practice of nursing. And that's what we set out to do. The purpose of the theory of nursing as caring is to provide a way for nurses to articulate a unique focus for the discipline of nursing and an integrated system of value, thought, language, and action such that nursing is understood by us as having as its end point caring and the nurturing of caring. The view of the theory is that's why nursing exists as a discipline separate from any other.
Thank you. Well, and you mentioned one thing that I want to go back to. Would you describe your theory as a grand theory or a philosophy for nursing, or a little bit of both?
When you first asked me about purpose and I started talking about grand theory, this theory was developed from the understanding that was sort of brought into nursing by Oram, basically from the philosopher Jacques Maritain from Canada. And he had a theory of theories about levels of theory. And he posited grand theory, which, as Jun Kikuchi phrases it, a philosophical framework. And then there's middle range theory, which is used to guide thought and action in specific categories of nursing situations. Not all nursing situations, but specific categories. And then Maritain also had the idea that the third level was practice theory. And that's the theory that the nurse, him or herself, creates and operationalizes in their practice. And this practice theory has as its umbrella the grand theory or the nursing philosophical framework. And then it draws, depending upon the type of nursing situation, on a whole range of middle range theories, some of them from nursing and some of them from other disciplines. And by drawing from the umbrella down through the middle range theories, the nurse creates a practice theory that basically characterizes that nurse's practice overall, as well as provides immediate guidance in each instance of nursing. So I guess your question, you said either or both, and I wouldn't even dichotomize the ideas. Mm-hmm. We developed our theory to be a grand theory, which we see as a nursing philosophical framework, and that's what we call it.
Okay, thank you.
And that's what some others have called it. McCants and his colleagues did an analysis of 4 nursing theories that they considered to be grand theories. Mm-hmm. And there's been some other work done analyzing and comparing these theories. And basically, nursing as caring stands up as a grand theory.
Mm-hmm. Why don't you tell us about the major concepts of the theory?
Okay. When I talk about the major concepts of the theory, I'm going to be referring back to the basic assumptions underlying the theory. I think rather than just mentioning the assumptions and then trying to give meaning to them, I'll start with the concepts and then touch back to the assumptions.
Perfect, because I'm gonna, yeah.
Okay.
Perfect.
All right. The central concept of the theory of nursing as caring is the statement that the unique focus of nursing is nurturing persons, living caring, and growing in caring. So that's the core, that's the central idea. Everything else is an elaboration of that. A concept that is very important to practicing and working with nursing as caring is the concept of the nursing situation. Mm-hmm. And we describe a nursing situation as a shared, lived experience in which the caring between nurse and nursed enhances personhood. And we talk about personhood as being the process of living life, grounded in caring. Okay, so we have those basic ideas. I'm going to follow kind of an outline that we actually use to develop the theory.
Okay,
And that is first to state the unique focus. These points came from the Nursing Development Conference book, mm-hmm. Nursing Development Conference group books, which is called Concept Formalization, Process and Product. So I'm not inventing mm-hmm. this. Mm-hmm. So first of all, we stated the focus of nursing already. And then we asked the question, what is it that nurses do? Because nursing is a learned profession. That means that it's a group of people organized around an explicit body of knowledge to bring about results in the real world. Mm-hmm. So the next thing then is to talk about what nurses do. And from the perspective of nursing as caring, what nurses do is enter into the world of the other for the purpose of coming to know that person as caring person, as person living caring uniquely in the moment and expressing hopes and dreams for growing in caring. So that's a key concept in living the theory, in practicing based on the theory, the idea of what do nurses do. The next question is, why do nurses do what they do? Why they do what they do, grounded in this theory, is to enhance personhood. Let me change that. To participate in the enhancement of personhood, because nurses don't effect change. Nurses don't craft something and stick it on a patient. So facilitating the enhancement of personhood, I would say, is purpose. And then sort of the last in this series of questions to be addressed is, what is created in and through nursing? Now this particular item, in its original formulation, they asked the question, what's the end product of nursing? And this formulation was developed back in the late 60s, where nursing was pretty much, not just nursing, but professions in general, were viewed very mechanistically. And so Anne and I changed our way of languaging this particular criterion, and we say, what is created in and through nursing? And what's created in and through nursing is the caring between. It's through the caring between nurse and nursed that personhood is enhanced. Okay, now we've got that concept. And I should, at this point, refer back to a couple of assumptions. The first and most basic assumption that underlies the development of this whole theory is that to be human is to be caring, period. No questions. Now, that's a hard assumption for a lot of people to accept. I would say that to study the theory of nursing as caring fairly, one has to temporarily entertain that assumption and go from there to study the theory. And then when you're finished studying it, if you can't adopt that assumption, then this wouldn't be the theory for you. And that doesn't always come all at once, but just to recognize that that's a basic assumption. Another basic assumption is that caring is lived moment to moment. That we are always our caring fullness, and we are always growing in caring. In nursing, there is nothing to be fixed. Well, this is another assumption that tells us this is a different kind of nursing theory from the nursing theories that were invented back in the 60s and 70s, where we were still into the mechanistic man as machine view of the world. Let's see, when some of the other assumptions become necessary to the discussion, I'll bring them in. Okay, so we have the focus, we have the nursing situation, the actual engagement in the caring process of nursing. We use the concept call and response. And for anyone who's studied Patterson and Zrad's theory of humanistic nursing, they'll recognize that phrase. And that's where we got it. Patterson and Zrad's theory of humanistic nursing was really, I would say, the underpinning value system that we drew on when we developed the theory of nursing as caring. We used some of Orum's work to help structure the theory, and of course we drew on what was known at the time from Leininger and Watson and other theorists about caring in nursing. But if you were to say what nursing theory is this an evolution of, we would have to say it's the theory of humanistic nursing theory. So we have the call and response. when the nurse enters into the other's world in order to know that person as a caring person, the nurse hears calls for growing and caring. The nurse hears calls for being affirmed as caring person. And then the nurse crafts or creates or co-creates nurturing responses that address the calls that are heard in the nursing situation. That is the practice of nursing, entering into the world of the other, coming to understand who that person is as caring person, and in that understanding, hearing calls for unique forms of caring and crafting and extending unique responses of caring nurturance. I think those are probably the key concepts. There may be something I'm missing, but if so, I'm sure we'll pick up on it.
Okay. Okay, when you were talking about the unique responses and the nurturing responses, that let me ask you about how that relates to ways of knowing.
As you were formulating your question, I was thinking, okay, I'll go to ways of knowing. You already thought about that. One of the